I am recording this simply because this is the presentation. And welcome everybody. We're going to talk today about the back. And the reason we're going to talk about the back is so many of us have thrown our backs out. We have injured ourselves. We have overlifted and gardened, and it was winter, and we stretched our ligaments and tendons. Can someone share their back experiences? Ruth, can you share your back experience, how you hurt your back?
Well, this goes back, it must be 10 years ago or 11, when we were taking a long walk in San Francisco with my husband and his sister and my brother-in-law. And I started to feel so bad. I couldn't walk. My whole left side was close to paralysis. Mm-hmm. I could hardly make it to the ferry. We came by ferry from Larkspur. So mm-hmm. I did, with my husband's help, kind of holding me up, get to the ferry, and he took me into Kaiser when we arrived in Larkspur, mm-hmm. And they did an MRI and all kinds of I don't even remember. I was there for about four or 5 hours, mm-hmm. and they determined that it was my lower back. It was what's the name of it? It's a slip disc in my L5.
Yeah. Okay.
And I was able to slowly move over the course of several days, but it took several weeks of physical therapy before I could even walk. Initially on crutches. I used to play tennis before that. I mm-hmm. remember walking to the tennis court to watch my teammates, and it was a disastrous thing for me to have to watch what I used to be a captain of my team, to watch these people playing. It just hit me so hard. Wow. But eventually I was able to, through physical therapy and movement, and I was able to start walking again without crutches, without any support. Mm-hmm. And eventually I started playing tennis again.
Wow.
But I did regularly get an epidural on my back, the steroid injection. Mm-hmm. And that went on for several years. Mm-hmm. But the pain comes back, and it's still there.
Of course. The pain comes back because the fundamental problem is not resolved. The steroid will help temporarily, right?
Right, exactly. But okay. Now I haven't taken a steroid for the last 2 years. Instead, about a year ago, they put me on a nerve pain medication called Gabapentin. Mm-hmm. And I don't know if you're familiar with Gabapentin, but it is a fairly potent medication, and sometimes I take it twice a day, in the morning and late at night. Mm-hmm. And after I take it in the morning, sometimes I feel a little slightly dizzy and disoriented, and I believe it is from that. I'm not sure, but it has helped the pain level. Mm-hmm. So mm-hmm. I can walk, but it's still a discomfort. When I stand for more than 10 minutes, I'm in discomfort and I have to sit down.
I see. Gabapentin is a serious toxin for the body. It has some very serious side effects, and it does cause vertigo and dizziness. And one of the problems with that, as you grow older, is you fall down, you break something, and that's far worse than enduring pain, if you follow me. And go to a site called askapatient.com, and you will see the side effects of gabapentin, steroids as well.
Wait, can you repeat that website? Sorry.
Askapatient.com. Go
Ask
to
a patient. Oh,
Askapatient.
okay,
Askapatient.com
okay.
and look at the side effects of gabapentin. They are horrific. They are horrific. And I don't know how frequently you've been taking it, but if you've been taking it long term, you know, there's a lot of damage that's done to the body. A better way, we're going to talk about a better way now, a more
Okay.
natural way. Steroid-free, gabapentin-free, aspirin-free, Advil-free way. Because all of those things are temporarily going to alleviate your pain. But what's going to happen if you block that pain and continue to do the things that you're doing with your back is you're going to damage it more. Pain is a signal to your body that something is not right. Your discs are rubbing on each other, or the interdisc, the little thing, the sac that contains the bursal fluid is damaged, and you're simply damaging it more and more. Fusing your discs does not really help, and I'll show you a picture of the back and what I mean by fusing the discs, because now you've fused the discs and those two vertebrae are fused together, so the stress is now falling on the other vertebrae. So you find a lot of people with fused discs who need more surgeries up and down their spine, which does nothing but make you sicker and more disabled. Anyone else want to share any back pain experiences? Thank you, Ruth.
Okay.
Anyone else want to share back pain experiences? All righty. So I had, the reason I chose this topic was December, I threw my back. It was winter. It was very, very cold. I was out gardening for several hours and I was crouched, and I'm very good at crouching, but I was crouched with my head cocked on one side for several hours, planting 100 bulbs. And I was fine when I got up, went home, and that night my back got seized. Not my back, but my right hip got seized. And I have never experienced pain like that. And that is when I cast about for things to do. And I did all the wrong things, which is first I thought, oh, this is just a crick in my hip. If I exercise it, if I just do some hip hinges or yoga, I'll feel better. Of course, it got worse. I did hot baths. I thought I'd feel better. I was temporarily better, but afterwards it seized up more because it was cold outside. And so then in my pain, I actually read up a lot. Besides taking homeopathic remedies and trying these things, I read a lot, and finally I found the answer to my problem. And
Shima, can I say something?
Yes, please.
So I think I've seen a pattern that the body is not meant to be held in one position for a long length of time. This happens to a lot of people that go on a long drive and think they don't have to stop and take breaks. They just stay in the same position. That's not good for the body.
Exactly. Know your limits. Know that you cannot be frozen in one spot like this for hours on end. You're going to do extreme damage to your spine, to your, to your vertebrae, basically. And so I think one of the things that you want to look at is, how did people historically, people all over the world, do intense labor and for hours at a time without back pain, without hurting themselves? What's a good way to stand? What's a good way to hold yourself and walk? And the person that I landed on was my namesake, a person by the name of Esther Gokhale, who's my hero. And I bought the pain book, the 12 Steps to Pain, and there's a couple of pictures that she mentions that I sort of wanted to show to us. And the first one is, do you see my arrow pointing to the first spine here?
Yes.
See how crooked that spine is?
Mm-hmm.
It goes in a deep S curve, and a lot of us have this curve. Richard has a curve over here at the top. I have a curve down here at the bottom. 100 years ago, People had spines that were much straighter because our chairs were straighter. We sat up straighter. Our teachers and our mothers told us to sit up straight. And our backs, because they were straighter, the vertebrae were stacked on top of one another in a more vertical manner. And do you see if it is crooked like this one here? Do you see my arrow?
Yes.
If it is crooked like this, you are pinching this part of your spine and you're pushing out the interdisc bursae out here. And you're gonna have damage on this side. And you're going to crunch your discs here. So the key here is to pull your vertebrae in a way that you're stretching your spine, but you can't do traction 24/7. You cannot sit in a traction machine for 24 hours a day. And so Esther Gokhale has come up with this method of sitting stretched, lying stretched, walking in a stretched way, holding your back in a way that's healthful, that helps you heal your severe back injuries. And she had a severe pain at her tailbone, I think L5S1 or something like that, at her sacral bone. And it was like ice picks in her bum, in her bottom, where she had to walk at 2 in the night. They did surgery, they fused those discs, and 2 years later, the problem just restarted. So she took it upon herself to heal herself. And I cannot tell you how important it was for me to realize that my posture was bad. Right now, when I sit in this chair in front of you, I'm sitting with my butt sitting on the edge of the chair and the rest of my body downwardsly sloped. And when I do that, my spine is stacked up. We're told to tuck our pelvis in. And the truth is the opposite. You want to tuck your butt out like a tail, like a dog sitting on their tail. And when you do that, when you tuck your tail out, your spine straightens out. I would recommend heartily that everyone take Esther Gokhale's posture class, especially if you have any kind of back trouble. I'm going to take it. I'm going to make Richard take it. Richard has back problems because his back is bent at the top. He doesn't bend at the hips. He bends in the middle of his spine. So look at how this woman is holding her neck up beautifully straight. Her back is straight. She's got the baby held so that his spine is very straight on her hip. And her tail, her butt is tucked out. It's not tucked in, like they tell you in Pilates or ballet or modern fashion models. They have their pelvises tucked in, and therefore their backs have to hunch, which will result in severe back problems. You see these two guys on the right-hand side?
Yep.
I'm pointing the arrow at their spines, which are straight. They're not curved at the top. They're not curved at the low back. They're straight, and their butts are popping out. These beautiful muscular buttocks are holding the weight of their body. The spine is stacked, vertebra for vertebra, one on top of the other, and their posture enables them to run for miles, stand for hours on end without hurting themselves. How many of us sit like the figure on the left here?
Yeah.
So right now, as you're sitting, folks, move your butt to the edge of your chairs and straighten your back so that you're not putting this kind of pressure on your vertebrae, where you're squeezing at them from the inside and the bursa are popping out from the back. This is because this person's tail is tucked in. When the tail is tucked in, all the weight of your internal organs is falling on your symphysis, which is a soft tissue. It's not falling on your tailbone on the bony structures. Whereas if you sit with your tail tucked out, your spine automatically straightens out. Sorry, I had to let the dogs in. And this is known as stretch sitting.
May I say something about going back to the standing one? Because it fits in with this also, with the sitting. Is when I was teaching pregnancy classes, because the pregnant women have so much weight in front of them that their back really sways a lot.
Yes.
And the thing is, what we worked on was realizing that the spine, if you picture yourself as a kangaroo,
Yes.
and
Yeah.
your spine at the end, at the tailbone, is like the tail for the kangaroo, and you sit on that tail. Now that allows you not to have to hold a position. You don't have to hold your spine in a certain position. It relaxes into the tail and is in that very straight like position that you're talking about.
Yes, exactly.
And it's hard to describe just by words, but
Yes.
it's really fascinating if you stand up with your feet just hip distance apart, and you picture a tail, a kangaroo tail, coming off of your tailbone. You picture sitting on it.
Yeah.
And it allows you to release and relax that part of your spine, and it falls, everything stacks up that way.
Exactly.
Yeah.
And I found that at that time when I had our health and nutrition club meeting and I met with some others, and this was the only way I could sit. And it's not until your back is broken or hurts a lot that you realize how important it is to straighten the spine. And so I mentioned this here because I will not belabor what the Go Clay method is or how to do all those stretches and stuff. Such you can take classes for that. The point I'm trying to make is there's only one way to fix your back, folks. It's not surgery. It is not pills. It is not painkillers. It is your posture. And by posture, what I mean is day in and day out, you practice this way of walking, this way of sitting, this way of sleeping, so that your back automatically gets traction. The space between your vertebrae increases and your pain goes away. The second you take painkillers and steroids, you're basically encouraging your body to slump or to sway or whatever the posture was that was causing it in the first place. So I would encourage you to read a lot of the stuff is free on the internet. Go Clay method, stretch sitting, stretch standing, and stretch walking and lying. Super, super important to look at if you have any kind of back problem. What I have is this problem. What Richard had was this problem. He slumps his back. It especially slumps at the top of near his shoulders, and he has pain, sure enough, below that. I tend to slump here because I have a sway back, and that hurts my vertebrae here. And so I need to focus on pulling these vertebrae out so that my spine is straighter and the tail is still tucked out.
I would like to add something that I've learned from some of my practices that's helped me immeasurably.
Mm-hmm.
And it's the idea of what we call a sky hook. And even with the back straight, if the head is sloped forward, irrespective of the straightness of the spine, it creates additional tension. So if I imagine a hook that goes up to the heavens, that's coming from the crown of my head,
Mm-hmm.
and it allows it to be pulled ever so gently, not that I'm pulling anything, but I just don't imagine that. It allows my head to remember, or for me to remember, to keep that upper part of the spine relaxed and straight.
Excellent. Yes. That's a great, great idea. So guys, imagine something that's pulling your head from the top. You're raising your neck, you're raising your spine. If you have lordosis, you're raising it from behind your tummy. If you have kyphosis, you're raising it from behind your chest and straightening it out and tucking your tail out rather than in. And that is the single most important thing you can do for the health of your spine if you have pain, any kind of damage, any kind of trouble. It's not exercises, it's not pain-killing meds, it's not surgery, it is this simple thing. And it's subtle, and it seems initially like a lot of work, but just as Lori said, if you pay attention to it, you will get there. It is paying attention to how you're holding your spine when you're sitting, when you're standing, when you're lying, and when you're walking. And what's gonna happen if your spine is not like this is you're not gonna have constipation. You're not gonna have bowel problems. Your bowels are not gonna be constricted. Your chest will expand, it'll have enough room. You're not going to have depression. The people who slouch a lot tend to have depression. If you straighten your shoulders, your lungs have more place to breathe in and out of. And so that is really, really important. And I would recommend that you go look up the Go Clay method, you go take classes, or don't even have to take classes. Just watch the videos and practice it. Tighten your pelvis and tighten your bum and use your buttock muscles to walk rather than your joints to walk. So you want to use your muscles to lift yourself, muscles to put your legs down, so that you're walking in a smooth gliding motion. But watch the videos; those are better than me explaining them. And so this is kyphosis. Kyphosis meaning the spine is curved inward towards the chest. And as you can see here, the diaphragm is constricted, the chest is constricted, and you're going to have all sorts of problems from this. And a lot of this happens as you age, you know, or you're depressed, or you're sad, or you're cold, or you've been gardening in a certain fashion and you're kind of used to it, and lo and behold, you get this searing backache. And what she has done, Esther Gokhale, is miracles with people who she has simply trained on going from here to here, just straightening up their back in little bits and pieces. If there's spondylitis, you have to be much more careful. If you have a slip disc, you have to be much more careful. But this is the only solution to getting better. So if any of you have severe back problems, go to Palo Alto, take her one day or whatever course, or they have trainings in other places too. But learn how to sit, walk, lie, and stand. And this is a close-up of what happens over time. You're either playing tennis and you're bending your back over here. You're gonna crunch these vertebrae on this side, and you're gonna push out the bursa over here. And you're gonna suffer intense pain. The nerves that are coming out of these are gonna get pinched, and you will feel radiating pains in strange places, such as your hands, your legs, your head, and so on. And for people who've had this, who have done the Go Clay method, who have straightened out their spine simply by dint of addressing their posture, find great health benefits in other places in their life as well. Any questions?
I have a comment.
Sure.
Years ago, I took a workshop of the Alexander Lowen technique.
Mm-hmm.
And we practiced our walking, and they showed us, it was a demonstration, if your jaw is at the least bit tight, your pelvis is tight.
Yes.
Or your walk is totally out of balance. So when you're practicing all of this, always pay attention to your jaw, make sure it's relaxed. so that your pelvis can relax into the proper position that it needs to be in. You don't have to be holding things that way. They fall into the proper place, unless there's extreme,
Exactly.
issues,
Exactly.
then you have to remedy that. But if you don't have extreme issues, relaxing your jaw will allow your walk to be much more balanced.
Exactly. Absolutely. Absolutely. Excellent. And so, guys, the point here is these are simple things you can do to take care of your spine, and you want to do them because that is the only way out of a life of terrible pain, misery, drugs, dizziness from the drugs, heart attacks from the drugs, constipation or diarrhea from the drugs, falling down, hurting yourself, and making yourself much more dependent upon others. Fix your spine. The other thing that's very important is, excuse me, if there's a change of seasons, it goes from warm to cold, you're an active person, and your ligaments or your tendons constrict. You've been working hard, it's freezing cold outside, which is what happened to me. My back was exposed at my butt because I was bending over. It was freezing cold. I sweated, and then the sweat cooled off, and my ligaments just about shrank. There is a wonderful homeopathic by the name of Rus Tox for fascia that are sensitive to changes in temperature and weather and from overlifting or overdoing it in one position. Where arnica does not help frequently, Rus Tox in a potency of 1 m is essential for people who've had their backs seize up on them. I took arnica for the initial pain when this happened to me, and it took the pain away, but every time I bent it at a certain angle, it would hurt like someone had torn my insides out. And when I took Rus Tox 1 m the night before, the next day, it was magically almost that my fascia, my ligaments kind of straightened themselves out. So let us differentiate between arnica, Rus Tox, and something called Bellis perennis. Arnica is for bruising, contusions, you fall down, you hit your head, black and blue marks, but not broken skin, bruised, black and blue, purple marks, that's arnica. And what you want to do is have these things in advance, folks. I guarantee it, sometime in your life, you're going to fall down, you're going to overdo it, you're going to hurt your back, hurt your hip, pull a muscle, pull a ligament or a tendon. At that time, you want to be able to reach out for your arnica, low potency all the way to high potency. You want to be able to reach out for your Rus Tox, low to high, and something called Bellis perennis, which is for old injuries that have just not healed because at that time they were not addressed properly. So Bellis perennis is for deep-seated injuries that have not really healed over time. One of the key things to remember when you have pulled something is do not overstretch. All your muscles, all your ligaments and tendons, in response to that trauma, become like shrinking rabbits. They become terrified rats and mice, and they will just shrink and shrivel up. And if you try to overstretch a muscle or a tendon that's not ready to be stretched, you're going to hurt yourself very badly, which is what I did and learned my lesson because this had never happened to me. The second thing you want to do is rest. As soon as you feel the seize or the pain, please rest. Don't try to work into that pain until you've determined, what exactly is going on. And a warm, wet towel really helps. I microwaved my towel. Yes, we have a microwave because Richard insisted on it. And this was one of the first time that I used it. Wet towel in a microwave and then drop it on your back. It feels really good. With that, if you have any bad injury, expect it, especially if it's soft tissue injury, to take 3 to 6 weeks to heal. Don't rush it. Anytime you take an aspirin, what happens? Anyone guess what happens when you take an aspirin? Come on. We have talked about this for
You get,
almost.
you get immediate help, but long-term pain, long-term problems.
Yes. You bleed, you destroy your kidneys, all the NSAIDs, you destroy, they're very hepatotoxic. The steroids shut down your immune system over time. You'll have kidney failure over time. But more importantly, they destroy your connective tissue. They destroy the very tissue, your proteoglycans that you're trying to fix. So when people sprain their ankles and they take an aspirin, they're destroying their tendons and ligaments, which is the last thing you want to do.
I wanted to share something that's helped me considerably over time when it's cold and my butt is cold, or I'm in a place where it is cold. If I'm in the house, I use a heating pad, which gives me, I know the electrical magnetic field is maybe not so good, but the warmth that comes in through the base of my butt is very, very welcome, and nothing tends to seize if I do that.
Oh, that's a great idea. Great idea. Warm it and loosen it. Warm it and loosen it.
So may I add?
Sure.
That brings up something really important that I've experienced in my life 2 times, especially. I was in an automobile accident.
Ah, yes.
But I decided to do Pilates because Pilates was recommended to me. And, you know, the thing I want to say here before I tell the story is it's really important to warm up your body before you start exercising.
Yes.
And I went to this Pilates class, and it was at a gym, and their heater was broken. So the room was cold. I injured myself more by trying to heal myself with the Pilates because the teacher took us through all the stuff while our bodies were cold.
Oh my God.
But then I decided I would do dance because there was at College Marin, there was this fabulous dance teacher. And I went there and we had a wonderful long warm up before we did the dance. And my body was healing. I said, whoa, I can move in ways that, you know, since the accident, I have not been able to move. But then she retired. And the person they brought in did not know how to do warm-ups. And my body started to freeze up again because we were not warmed up and we were put through too much rigid exercise. And the thing I want to stress is how important it is to warm up your body before you do any of your exercise.
Lessons learned. Yes. So true.
I'd like to add something, another thing that I've used or I'm wearing right now, which is an insulated undergarment or below my pants, which are warm leggings, which keep the heat in. And I do that when my legs are exposed to cold. And that again is a wonderful help of keeping that condition warm.
Exactly. And that is exactly what I failed to do. It was icy cold. My bum was exposed. I overdid it. I sweated and then it froze.
Yeah.
And that's just the worst possible way and guaranteed back and hip problems. And then it took a while. It took a while for it to get better, but it did. And now it's all better. But I wanted to contrast that with people up and down my road. This will happen in December, and mysteriously and strangely, predictably, a lot of people threw out their backs because they were all gardening, they're all planting. It was icy cold and they overdid it. Our neighbor did the same thing. He is still not healed. He hurt his neck in November. He went to steroids and NSAIDs and a Kaiser protocol, and he's taking all these things, and his neck is still in one of those things, not healed, in dire pain. And so One of the things to remember is the allopathic medicines are not going to hurry up your recovery. They are going to increase the span of your recovery by at least double. So his is going November, December, January, 3 months. Richard and I we both hurt our backs because we both did the same stupid things in the same week. And in between 4 to 6 weeks, we're 100%. Now we're 100%, but at 3 weeks, we healed. And so what I wanted to say was soft tissue injuries take a long time to heal. Don't try to rush it. If you try to rush it, it's going to take double the time. And by rushing it, I mean taking aspirins or Motrins or steroids so you can operate, but in doing so, you're not resting yourself. You're not resting yourself and you're really damaging it further.
I wanted to add something to the suggestion I made a few minutes ago about the lower warmth with a layer of protection. And that's for the upper part as well, from the belly up, the chest and all that. I've used silk and wool, which again keeps me really comfortable and warm. And there are different degrees or densities of wool, so you can make it adjustments according to the weather in your own body and what activity you're doing, but that helps me as well.
Excellent idea. That's an excellent idea. Wool and natural fibers will mop up sweat, keep you warm, insulated. Excellent idea. But the key here is don't overstretch. You overstretch, you destroy what little health you got in that area. You want to rest. You want to warm the area from time to time. Understand that it's going to take a long time to heal. The more medications you use, the longer your back pain is going to last. So what would have been fixed in, say, 3 to 6 months, 10 years later, you're going to be still in pain. You don't want that. You do want to use homeopathics because that'll take away the inflammation. The ligaments and tendons will just fall into place. Ruta 200, Ruta Graft 200C is another very good one. But for me, Rustox was magical. And the other thing is if it doesn't heal in a very short time and the injury is carrying on, then you have a long-term deep-seated injury. For that, Ruth, I would recommend Bellis perennis for you, as well as Rustox. So please get these remedies and try them.
The Bellis perennis and what else?
Rustox. Rustox.
Oh, the Rustox.
Yeah.
Okay,
Rustox.
and at what level? 3?
1M. 1M for you, both 1M.
Oh, that's the maximum.
That's well, there's more than that, but 1M is a high potency and it'll really help you. And keep taking arnica whenever it hurts instead of NSAIDs and aspirins and Motrins. You're better off. Arnica will actually heal the injury rather than suppress your immune system or your sense of pain.
Okay, and where do I get these? At that?
You can go to Good Earth and order them. Or you can go to Washington Homeopathy. Washington Homeopathy, that is homeopathyworks.com, and you can order these there.
Okay, thank you.
And I'm recording this so you can look at it again and look at the PowerPoint and order your remedies. And so on that note, I'm gonna shut off the recording.
Wait, one other thing, just
Sure,
about
please. Yeah.
about the stretching.
Yeah.
I'm sure people know this, but I just want to reinforce it, is that people stretch and they bounce thinking that that's going to stretch it better. But bouncing is absolutely contraindicated when you're stretching. You just do a slow stretch. You stay there for an extended period of time, allowing the muscle to relax and to be able to give way. But bouncing just stimulates the exact opposite. It makes the muscle want to contract. Yeah.
Excellent point. And so all the folks that have back problems or have had back problems, please try the Esther Gokhale method of sitting, stretching, and all that. Get your homeopathics. I cannot emphasize enough. We've had someone break their shoulder recently. They didn't have half the remedies they needed. Guys, you don't want to buy remedies after you get sick. It's too late. You end up in emergency where they do all sorts of terrible things to you. You want to be prepared. You want to do it naturally. The other thing I wanted to talk about was food, and that is raw milk, master tonic to dissolve the scar tissue, lots of greens slathered in fats, good red meats, good animal fats, and liver. These are the things you need to strengthen your tendons, your ligaments, give them the vitamins they need to make the collagen that they need. And above everything, chicken foot broth, which Sunshine excels at making, or any collagenous soups and stocks. Oxtail is great, knuckles and joints. So those are very, very good for building your connective tissue if you're injured yourself.
I have two things I would like to add, especially about chicken feet, which Sunshine introduced me to, but I realized someone claimed that since I like chicken feet now, that I must be Hungarian. But I responded that, well, the Chinese do it too, so I'm part Hungarian, part Chinese in my past.
There you go.
The other thing was the inclusion of warmth, and I realized I needed or wanted to cover the entire body. I also am aware that if it's cold and I'm going outside, I will wear wool socks. Also, I will always, if it's even the chance of cold, keep a scarf with me in a pocket, silk or wool. And also, if I'm going to be out and I know there could be even a slight wind, I wear a wool hat. So there's other things to cover the entire body. So really, everything is connected, of course. So it's connected to the back and everything else.
Very true. One part of your spine, if your neck is cold and the rest is hot, you're going to get into trouble.
Yeah.
Yeah. Yeah. Very, very good point. So,
what surprised me about that just last week, I can't remember what podcast I was listening to, but they mentioned that you lose 80% of your heat off of the top of your head.
Yes.
Yes.
And I didn't realize that. And so I've been wearing a hat now each day.
Mhm.
And it's great. It's a wonderful addition. Yeah.
Yeah. It's been mighty cold this December. And if you're out working, you better have bundled up properly, because I got into a boatload of trouble. That took me 3 to 6 weeks to recover from.
Yeah.
Ruth, did you have any questions? Did anyone else have any questions?
No, I think you covered a lot, and I've written down what you suggested. The Ignatia 200, the Arnica, the where is it? The Rostox and Bellis perennis.
Yes, yes.
I
And
take
the food.
all of them at the same time?
No, separately, depending on what symptoms you have. Email me if you have questions on that. Email me. But the most important thing for you is posture. Take those posture classes, or at least watch the videos and try to sit in that way. She has never had a day's pain since she started doing that. And millions of people, literally millions of people, have benefited from this. No surgery, no medicines, no knife. The back heals.
Okay.
And what you want to do is wean off of all these drugs, because that'll tell you where the pain is so you can actually address it.
Okay.
Sushma, I joined late, so I'm not sure if you spelled it when you began, but would you spell the name of this woman whose classes and book you referenced?
Yes, her name is Esther Gokhale, and she has the Gokhale method. I wish she was related to me, but she's not. But
Gokhale is the same as your name, right?
Same as my name, same as my name. And she works out of Palo Alto, and she's a magician with Vax.
Good, thank you.
All right, thank you, everybody. I'm gonna stop recording now.